For a second. I don't know if you want to... Hi, I'm Stephanie Cadieux, Minister of Children and Family Development. I'd like to thank the McCreary Centre Society for their work in producing this report, and for the students that are here helping to produce this film. Taking the pulse and health of young people and the well-being of young people in BC helps us lay a foundation so that they can have the best possible start in life and the best opportunities for success. The province has been providing funding to the Society to conduct comprehensive research on students in mainstream public schools in BC since 1998, and the Adolescent Health Survey is used by government, schools and communities to assess, plan and create effective services for young people in BC. No one ministry can do all of this work alone, so it's an invaluable resource to the Ministry of Children and Family Development and to our cross-ministry partners such as education and health. The data contained within the survey influences and informs our approach to policy and practice, and it assists us in working collaboratively with our community and cross-ministry partners. Of course, our service providers also respond to the information offered by the survey, and they do that through adjustments to services and programs that they provide in the community. Ultimately, we'd like to ensure that young people are supported and equipped with the skills that they need to make a successful transition to adulthood. Those are difficult things to do. We're looking forward to reviewing the findings from the 2013 Adolescent Health Survey to help guide and focus government efforts so that we can better accomplish this goal. The survey is the only BC-specific source of reliable and accurate information about many aspects of youth health, whether that be physical, mental, or emotional. It also provides young people with an opportunity for their voices to be heard. The information that's generated identifies opportunities to reduce the risks and increase the resiliency of young people in BC. The Ministry of Children and Family Development is committed to evidence-informed policy and practice, and this survey is a key research component because it allows us to know what is or is not working, and more importantly, why. It's a tool that government depends on to make sure that we're providing young people in British Columbia with the programs and services that they need that are both informed and appropriate.
13% of students indicated having been physically abused or mistreated at some point in their life. This was a decrease from 17% in 2008 and 15% in 2003. Female sexual abuse rates decreased from 16% in 2008 to 13% in 2013. For males, sexual abuse rates decreased from 6% in 2008 to 4% in 2013.
We need to make sure that young people are being heard and are being encouraged to take up leadership roles, and that services meet their needs. So there's still a fundamental issue for me about how young people are perceived in British Columbia and whether they're taken seriously and their feedback is taken seriously. But I know that without this survey, it's hard to do that. But this survey really speaks well to things like making sure we have broader-based participation, and we need to, with a real strengths-based positive approach, respond to that. So everything from food, housing, and safety, there's a special set of needs there that we need to keep focusing on if we're going to see improvement year over year.
In the past year, 8% of youth did not get medical help when they thought they needed it.
There's also within our society a certain stigma that is attached to seeing mental health providers. I think one thing we can do is to try to destigmatize, try to appreciate that the negotiating the challenges of adolescence and growing up is a difficult process for everyone. These are new and novel challenges that young people confront, and they do generally require some degree of guidance and counseling. And this is not something to be ashamed of or embarrassed of, but something that we should willingly provide, and as adults we should enthusiastically provide young people. This is an important fact for us to acknowledge, that in fact we can make progress.
63% of youth who drank on the Saturday before taking the survey had at least 5 drinks. Rates of binge drinking dropped from 2003 and 2008, as did experimentations with alcohol, marijuana, and other substances.
So the ones that are doing really well continue to do well, and I think that, one of those things, we talk about prevention, and what do we really want to prevent? And for me, it's really that onset, that first time that someone uses. The later that is, the better it is for brain chemistry, but as well, the better it is because a young person can take some responsibility. They're trying things at a later stage because they've got a little more information. I also think substance use is kind of coming out of the closet in terms of something people are more apt to speak about.
11% of students reported not accessing mental health services in the past year when they thought they needed to.
If we can create this space where young people feel like there's no stupid questions about substance use or about mental health, if mental health is just part of a broader health perspective, I think we'll be on the right track. So that means doctors, that means parents, that means social services, that means teachers not having an issue talking about someone's mental health as part of their health issue. So like someone going to phys ed and working out their muscles, mental health has, there are muscles in your body to work out there as well.
Only 27% of males and 21% of females slept for 9 hours or more. Another 29% of youth slept 8 hours.
Lack of sleep is common for university students. What I find amazing is that this is being reflected in younger adolescents, grade 7 youth who are reporting less than 8 hours of sleep. It's just amazing because there's no reason why they shouldn't be able to get enough amount of sleep. I think it's just reflecting the increasing pressure that youth are facing nowadays.
3% of sexually active students reported an STI. This was a decrease from 4% in 2003 and 2008. Both male and female students were less likely to identify as completely straight in 2013 than in previous years. Youth who did not identify as straight experienced high levels of discrimination on the grounds of their sexual orientation. 69% of students who ever had sexual intercourse reported that they or their partner had used a condom the last time they had sex.
I think it's really important that youth know their rights and options, and that includes access to contraception and options around contraception, especially when it comes to the sexual health lens, because we want them to be practicing in the most safest way they can. Access to sexual health information is really important, and I think it can help with the survey, the results around bullying with young girls. If there's more access and youth have more information about gender and sexual orientation, which are often stigmas and sources of bullying for youth, I think that if we can better educate youth and we can better support youth in a sex-positive environment and give access to service for those youth who are having questions about gender and sexual orientation, then we'll see the bullying go down a little bit and we'll have a better understanding and a better empathy around those types of things.
In the past year, 16% of youth had suffered a concussion. Those who had experienced a concussion were more likely to have missed out on medical care they thought they needed.
Pretty close to 60% of the students indicated that the injuries that they'd experienced in the last year had occurred in the context of sport. And the one that's of most interest to me is concussion. And the statistics with regard to concussion are astounding. What that means is that the incidence of concussion is extremely high. And it may not be that all of those kids have had a really serious concussion, but they've had a blow on the head. And more importantly, what I think is that it means that they haven't reported it. And so people are not taking it seriously, and it is very serious.
39% of youth experienced verbal sexual harassment at least once in the past year. Students who felt safe at school felt more connected to their school. Those who experienced school-based bullying reported a lower rate of school connectedness.
What I see in these results is it's not a black and white issue. It's not there's bullies and there's victims. Often it's the same. One day you're a victim, the next day you're involving in a bullying behavior. So focusing on the behaviors versus sort of labeling kids and relying on reporting and zero tolerance versus, what are the issues? Why do students get into this kinds of behavior, and what can we do to be more positive? So it may mean that we've made some progress in some areas and we see that things are moving forward, but we see other areas that we say, well, we really need to look at youth mental health. And this survey is really unique in this province, as we have, I would say, as policymakers, we don't have a lot of really relevant and up-to-date research that we can rely on.
On an average school day, 20% of students took care of a relative, and 2% took care of their own child or children.
This is such an invisible issue. Lots of young people really are taking on these responsibilities, and we're not checking to see if it exists. They start to tell us that we need to know a lot more about these young people, but we're seeing some indications from the preliminary analysis of the results that these young carers are under more stress than their peers who are not in caregiving roles. I think just bringing the issue to the forefront is critical. It will also help in advocacy activities in terms of looking for the development of policies to support these young people and the development of programs. It's the first large-scale study of this kind in Canada to look at how many people are being young carers.
During the past week, only 17% of students aged 12 to 17 met the recommended guidelines for physical activity. Over the past year, 55% of students participated in organized sports at least once a week. The decrease in participation in informal sports seen between 2003 and 2008 continued, with a drop in participation from 69% in 2008 to 58% in 2013.
I believe that a healthy body creates a healthy mind, and what we need to try to do is ensure that our young people are involved in healthy activities, whatever that activity is. If they'd like to play soccer, I would prefer that, but there are a lot of other things that you can do.
Over 3 years after the 2010 Olympic and Paralympic Winter Games in Vancouver, 13% reported they were more physically active as a result of the Games.
So there's a direct correlation between what young people watch and their idols or their professional sports heroes, regardless of the sports, a direct correlation between watching that and wanting to go out and participate. And the Olympics, it doesn't surprise me. And in fact, it surprised me that it's only 13%. Because when you're watching your heroes, more often than not, you want to go out and you want to emulate them.
90% of students reported that they had a cell phone. 96% of these students had used their device on the previous school day. 19% of females and 9% of males reported that they had met someone through the internet who had made them feel unsafe. 85% of females and 79% of males used their phone or the internet after they were supposed to be asleep. Among these youth, only 19% slept for at least 9 hours on the night before taking the survey, compared to 44% of those who had no such distractions. 14% of students reported that they had been cyberbullied in the past year. 14-year-olds were the most vulnerable.
I think one of the really interesting things that stood out for me about this survey was the number of youth that reported using their cell phones and their electronic devices after they're supposed to be asleep. I think it has a big impact on the quality of sleep that teens are getting, and kind of reflects the difficulty that a lot of parents are having in establishing boundaries around the use of electronics. I'm really happy to see McCreary come up with some statistics that validate the idea that most young people are on their cell phones or an electronic device daily. It's really important for us to have those statistics in order to make sure that we're pushing forward programmings that encourage media literacy within the schools, that support integration of technology into existing curriculums, and move education towards members of the adult population that may not be as familiar with the details of this, of the effects of being online this much. They breathe it like air. We need to acknowledge that and work it into our professional practices so that we more adequately meet the needs of youth.
Having no food at home to eat for breakfast was a reality for 2% of students. 6% of youth went to bed hungry sometimes, and 1% reported going to bed hungry often or always. This is a decrease from 2008.
Not all poor children go to bed hungry. We know that the child and youth poverty stats for the province are much higher than 7%, so more than those who are reporting in this survey going to bed hungry. A lot of parents protect their children from hunger, so they go to bed hungry and make sure their children eat. And that's a very standard thing in low-income families. So we will use this data in our advocacy with all of our 90-some-odd partner organizations, of which McCreary Center Society is one, to influence, to inform the public about this issue, because child and youth poverty tends to be rather invisible. People don't see it all the time on the street. And to inform public policy that we'd like to see in place that would change this picture.
22% of healthy weight females thought they were overweight, compared to 4% of males.
Insecurity starts when you compare your backstage to somebody else's highlight, and I think that's a really big problem today. We just see highlights all over the place, and we can't even realize our own highlights. We just see our backstage per se. I guess for a lot of people, they don't want to speak out about it because they might be like, oh, it's just me, or I don't think anybody else really thinks about this, but just having those tangible statistics makes it like this is actually real, and this is something big, you know? It's not something to just ignore. Like, for example, I watched this video about how like Photoshop is used, just as an example, right? In like media, in advertisements, right? And a lot of people aren't aware of how much Photoshop is used and how much effort is put into one simple picture. And I think we tend to compare ourselves to that, maybe subconsciously, maybe consciously, and we just don't realize that's not actually real. What's real is us.
17% of youth who use transit always felt safe on public transport, while 5% never felt safe.
So it's really important to be able to have those numbers to say, like, no, you know what, this is a widespread issue. It is something that affects people's well-being and their health and their feeling of wellness and sort of integration in their city. Because if you don't feel comfortable going out in public or taking transit or just getting from point A to point B, that can hugely detract on the way that you feel about your surroundings and the way that you feel about even going somewhere.
It's really about acknowledging and recognizing that youth already have a voice. It's not about giving a youth a voice. It's listening to what that voice is, that specific group of young people, and catering to those needs. One group of people are going to need a completely different set of things to help them be successful in their peer support or in their group than another group. So it's important to recognize that.
What you just need is to give tools to people, to young people, so they can lead themselves and lead each other. And I think that's really important. Like, it's a big part of empowerment, is not having someone come in and try to save us. You know, and I think that's something to touch on too, is, you know, with this information that we have, I hope it is put to good use, but I hope that, you know, it's not with the intention of trying to save young people or trying to come and swoop in and help them. We need help to help ourselves.